Yeah, that was a great panoramics, and I just noticed that, she's got that lower molar, they did an apical, on it. So let's go ahead and take a cone beam and look at the apex of that and see, what the impact on. So it's a great opportunity to take a 3D view of that and see if there's any pathology or if that's actually doing okay. So why don't we go ahead and take a 3D view of that area and see how it's doing. Okay?
Let's do it.
Okay, awesome, great.
So like before when we took the pan, we want to make sure you do not have your earrings in and your hair's not in a ponytail. So step into the machine like before. And just like before, I'm going to step around to your right. And you will place your chin on the chin rest and put your front teeth in a little groove on the bite stick. I'm going to close the temporal supports in just a little bit, just as a subtle reminder not to move. Then I'm going to move your hands to give you some additional support to the ring underneath the main component for the chin rest. So, like before, we're going to utilize our positioning lasers. We want to make sure you're standing up just a little bit. I'm going to bring the machine up just slightly, just to help you stand up straight as much as possible. And we're going to utilize two of our positioning lasers. We have our mid-sagittal plane laser going through the middle of the patient's face, and she can see her reflection in the mirror in front of her, which can help her guide herself to make sure she's positioned properly. And then for my information, we're going to utilize the canine laser, which is going to indicate the front of the field of view. So anything in front of that or anterior to that, we're not going to get in the image, but it looks like we will get our anterior teeth, and because we are getting a 9-centimeter field of view, we should be also able to get our third molars as well, if they're present in this patient. Once everything is positioned properly, like before, we'll press ready on the control panel or on the remote, and then we're ready to fire and get our 3D image. So on our control panel, also on the computer screen, we have options to choose what we want to acquire for this particular patient. So we have presets for a child-sized patient, a small, medium, and large adult. And for each one of these settings, we have a unique KV and MA setting for those. So if we have a larger patient, a larger adult patient, we can certainly change that, and the kilovolt milliamp will change accordingly. We also have protocol options that we can choose from. We have our standard 3D image. We have, and each one of these will adjust for a different resolution depending on really what you're looking to get in the image. A majority of the time you should be getting the image that you'd like and the resolution that you need at 280 micron with a standard resolution option here. But we also have options for implant, for guides, for endodontics, for sinus, and for TMJ. For sinus and TMJ, we also have additional chin rests to help put the patient in the right field of view so that the anatomy is getting captured from the machine. And then on here as well, we still have our laser on and off option, a reset button. We can move the column up and down. We can cancel out of this interface. But now that we have the patient positioned appropriately, everything's ready to go. We've chosen the modality that we'd like. We're ready to click on Ready. Now that we have our patient position, we've got the desired protocol chosen on our touch panel. I'm going to press Ready on the control panel. The machine will move to a final ready position, and then the blue LED will now change to green, indicating that when we press the exposure button, radiation will come out and an image is ready to be captured. So once we've finished the exposure, we can have our patient step back. And as we remove the patient from the machine, the unit is reconstructing the image, and we'll have a preview of an axial slice on the screen momentarily to give us an option to confirm, reject, or retake. Once we've removed the patient from the machine, it'll take about 1 minute for the image to reconstruct at the standard resolution option. And once it completes reconstructing, it will show you an axial slice to give you a preview to see if you've captured the anatomy that you'd like. It looks like that we have, so we can click on Confirm. If we would like to take another image or reject this image, we can do that. But we're going to choose Confirm, and then we'll be able to see the image in our 3D imaging software.